Hello, good morning, everybody. I am Dr. Raktim Inti, and I am here to discuss on the topic of epidemiology of measles. So let's start the topic of measles. Measles, as we all know, is a highly infectious disease. Primarily, you see the disease in the childhood. It is caused by myxoviruses. When you think of measles, it is characterized by fever and catarrhal symptoms of upper respiratory tract. The catarrhal symptoms of upper respiratory tract will include fever, cough, coryza, runny nose, lacrimation, photophobia, all such things. It is associated with high morbidity and mortality. So these are the points that are very important as it occurs only in human and there is no animal reservoir to measles. So the last two bullet points will help you that the measles virus may be eliminated or if possible later on gets eradicated just like smallpox. These are the points of concern for us. When there is only one host that is human and there is no animal reservoir, the our human efforts will help in eliminating the disease. Coming to the problem statement of measles. Measles, you will see measles in endemic to all parts of the world. Even if the population gets vaccination, then also there are 40% susceptible children. It is seen rarely in case of industrialized countries, but in case of developing countries like India, it is very common. If you discuss regarding the reasons of why is it so, the primary reason for uh, common of in developing countries is due to the lack of immunization coverage in developing countries like India. And when we fail to deliver at least one dose of measles vaccine to the children, then firstly, the susceptible children proportion gets increased, and secondly, there are high chances of morbidity and mortality among the child. So, what are the challenges that we face in immunizing measles? Firstly, if the timeliness of immunization session is not correct or it's get delayed due to any reason, then the measles disease will not get eliminated. So, in a country like India, in many parts of India, you will see there is weak immunization systems, and due to certain political or geographical locations, hard to reach areas, some population may get uh, exempted or may not have access to immunization coverage. So, secondly, highly infectious nature of the disease. When the measles virus infects one child, then that child is very much uh, uh, infectious to others. It is such that when a child gets infected, then the surrounding children, if they are not vaccinated, the chance of acquiring measles is very high. And on top of that, if the immunization system is not uh, strong or robust, then the chance of infectious nature gets doubled. So, and as I said, due to inaccessible population because of conflict or human or financial resources, hmm, since the vaccination is not uh, given to the children, the measles as a disease cannot be eliminated then. With this background, let us begin with the epidemiological determinants of measles. When we say epidemiological determinants, we will think of agent, host, and environment. We will discuss one by one. Coming to the agent factors, it is caused by RNA paramyxovirus. Each and every bullet point here is important. When we think there is only one serotype present, then it is comparatively easy that we may think of eliminating measles as such. So, since there is only one serotype present, it becomes easy for us to double our efforts. Secondly, the virus cannot survive outside the human body in tropical countries such as India. So, when the virus comes out of the human body due to any secretions and all, then uh, the virus dies. So we can acquire measles only from a case of measles. So the source of infection is only a case of measles. There is no carrier state of measles also. So all the susceptible children who gets infected by measles will develop sign and symptoms and they will come to the healthcare delivery system. Then, since there is no carrier state, there are no hidden cases of measles and the measles as such will not get transmitted through the hidden cases. These are all the points important to think that this disease, if with all our efforts, combined efforts will help in eliminating the disease. Like I said, the infective materials for measles is the secretions of nose, throat, respiratory tract, secretions and all. Measles is very highly infectious during the prodromal stage. What is prodromal stage? We will be coming to it in the subsequent slides. The communicability of measles is 4 days before and 4 days after the appearance of rash. So, the isolation period is thus 7 days after the appearance of rash. Coming to the host factors, measles affects all age groups. It is seen early in developing countries, while in developed countries it is seen at a later stage. Since it affects all age groups, both the sexes are equally affected. One attack of measles generally confers lifelong immunity. But if the host have uh, a weak immune system or in an immunocompromised state, there may be subsequent attacks of measles in the same person. Maternal antibodies protect the infant till 6 months. It is also seen that the maternal antibodies may persist for beyond 9 months, and that is the reason in India the measles vaccine is generally given at 9 months of age. The measles disease as such is seen very severely in malnourished children. When the child is malnourished, it is high chance that the child will have vitamin A deficiency, protein energy malnutrition, and in such cases, the measles virus uh, infects, the infectivity is very high, and secondly, the severity of the disease is very high. Coming to the environmental factors, measles can spread in any season. In India, it is generally seen in dry seasons, while in the Western or the European countries, it is generally seen in winter seasons. Epidemics are quite common during the spring and winter. It is probably because of the population density and movements. It affects the endemicity also. In case of Western countries, where it is seen in winters, it is because of overcrowding. Coming to the clinical features, the measles is divided in prodromal stage, eruptive stage, and post-measles stage. In the prodromal stage, begins 10 days after the infection and it lasts for 4 days. So altogether of 14 days. And the symptoms that you see are the fever, cough, coryza, sneezing, nasal discharge, lacrimation, photophobia. You may also see vomiting and diarrhea in this stage, but however, it is generally seen in case of malnourished children due to vitamin A deficiency, and the vomiting and diarrhea are also the complications of measles. So it is very difficult for us to determine whether it is the symptoms shown in the prodromal stage or is it the complications of measles. So vomiting and diarrhea, we have to treat them accurately so that the child do not suffer much. The pathognomonic sign measles is the complex spot. It is seen in the buccal mucosa in the lower aspect behind the third molar. These are small bluish discoloration. Theoretically, it is known as pathognomonic sign, but however, in clinical settings, it is very difficult to elicit. It was first discovered by Henry Koplik. He was a pediatrician and probably he discovered in 1896. Coming to the eruptive stage, you will see maculopapular rash or macular rash. It begins behind the ears, coming forward, and then involving the face and going down to the neck, chest, trunk. After that, the upper extremities and lower extremities gets involved. The rash fades in the same order as it appears. How you see a maculo or maculopapular rash is shown in the figure. When it goes away after a certain period of time, it leaves a brownish discoloration, and that discoloration goes off within 2 months. In such cases, we should not have to treat the brownish discoloration as such. Coming to the last post-measles stage, here you will say weight loss, weakness, nutritional deficiencies, growth retardation, pyogenic infections, candidiasis, and pulmonary tuberculosis. These features may or may not be seen. You may see this post-measles stage in case of malnourished children where the severity of the disease is very high. However, in case of uh, patients who are treated properly with good nutritional support and all, you will see this post-measles stage very minimal. Okay. Now, like I mentioned, the common complications of measles are the diarrhea, the pneumonia, otitis media, laryngotracheobronchitis, post-measles encephalitis, and subsclerosing panencephalitis. Diarrhea is very common in uh, patients of measles. It is almost seen in case of 90% of the cases. Pneumonia is also very common. It is seen in 50 to 70% measles case. Otitis media is the third one where you will see it in 5% of the cases. Laryngotracheobronchitis, post-measles encephalitis are very rare, and the rarest is the subsclerosing panencephalitis, which you will see in 1 lakh cases of measles, and probably you will see this after a very long time, like 10 to 13 years after having measles. Coming to the treatment of measles, since this is a viral disease, it is just supportive care. The care is such that we should give prevention and treatment of the complications of measles, and we have to be assured that the patient do not have secondary infections. Breastfeeding is recommended wherever appropriate, and as well as nutritional support the patients is very important. ORS we give to prevent dehydration and to treat diarrhea. Therapeutic use of vitamin A is given wherever necessary. When you suspect the vitamin A deficiency, for this, we have to give the therapeutic dose of vitamin A, which is 50,000 international unit for given in 2 subsequent days. For patients of 6 months or less. In case of the patients who are 6 months to 1 year of age, we give a therapeutic dose of 1 lakh international units on 2 subsequent days. And when the patient is more than 1 year of old, then we give the therapeutic dose of vitamin A to be 2 lakh international units given on 2 subsequent days. Coming to the prevention of measles is the guidelines says that we have to achieve the immunization coverage of over 95%. We have to strengthen our national immunization schedule and program, the universal immunization program against measles, so that at least one dose of measles vaccine should be given to a 9 months old child. Measles vaccine is a live attenuated vaccine. It is found in as a monovalent or in combination like MR, MMR, MMRV. Under the National Immunization Schedule NIS, we give it as MR vaccine. It is given subcutaneously in the right upper arm. After administering measles, the immunity develops 10 to 12 days after the vaccination and for a long duration of time. Coming to the prevention of measles again, we have to give measles immunoglobulin to in case of special circumstances like when a pregnant lady who has who has uh, suffering from active measles delivers a baby, then that newborn will receive measles immunoglobulin within 3 to 4 days after exposure to her mother. Following that, the measles vaccination is to be given after 8 to 12 weeks. This will confer that the newborn will not have measles. However, it is to be noted that when that newborn is 9 months, the newborn will again receive the usual dosage of measles vaccine according to National Immunization Schedule. Thank you for listening. If you have any doubts, you can always comment in the video. Thank you.